Hello, thank you for joining us today. This is the San Francisco Breastfeeding Coalition kickoff. My name is Soler Spellin, and I'm the Interim Executive Director for the California Preterm Birth Initiative at UCSF. I'm also a co-founder of the Coalition for Black Birth Justice for California. I'm also a co-PI of this project, along with Ifeinwa, who we have the pleasure of working with as a trusted advisor and human milk feeding expert in this space. I'm so excited to welcome you here today. Coalition building is very near and dear to my heart. I've seen the most incredible things happen and come out of working together collectively with collaboratives such as this. And so, it's really a joy to be with you all today. It really takes everybody. So just a little bit of background about the Breastfeeding Coalition work. It really began with the San Francisco Department of Public Health, who contracted with us, PTDI, to produce an analysis of the state of breastfeeding in the city and county of San Francisco to help guide all of us, all of our stakeholders, all of us here today towards, what are some of the best practices and policies in this space. And two deliverables that we will share a little bit more about with you today were just a landscape analysis based on qualitative data, and also conducting and kicking off our breastfeeding coalition. So this is the first one, that's why we're here today. And we really took on this project because of how important it is when we're thinking about, advancing birth equity. I think breastfeeding is something, and human milk feeding is something that we don't pay enough attention to. We don't invest enough time and energy and resources into. And so it's one of the reasons I'm really excited to talk about this. This is something that's really important. I think we've been calling it sort of like the reigniting the breastfeeding coalition, because there was one. I don't know how many folks know, y'all probably know, there used to be a breastfeeding coalition in San Francisco. And so we are restarting that work, reinvesting our time and our energy and our resources into centering breastfeeding in San Francisco. We started out this project by crafting an incredible team who I think everybody's here today, but that team included some graduate student researchers and GSRs who supported the literature review and the translation of that important information. That included numerous barriers that are linked to racism and SES. There were also some considerations regarding return to work. And there was some information that was found around how many solutions that are out there are really theoretical and aren't examples of what can be successfully implemented, successful programs or interventions to support and advance breastfeeding. So a lot of that, you'll hear more about that today as we move forward. But I will pass it to the amazing team that actually did do all of this work. I want to give them their flowers and give credit where it's due. So I will pass it along. Thank you and welcome everybody.
My Wi-Fi is not doing great, so I'm actually going to switch to my phone. I think Ifeinwa wanted to say a few words as well.
Hi, good afternoon, everyone, and welcome. My name is Ifeinwa Siadu. I am an associate professor in the Department of Family Healthcare Nursing in the School of Nursing here at UCSF. First, let me say happy National Breastfeeding Month and Indigenous Milk Medicine Week. Today is day 2 of Indigenous Milk Medicine Week, and so I just want to encourage everyone to take some time to explore the wonderful events happening in California and throughout the US to celebrate this important week. As Soler said, this is such an important meeting, and we just greatly appreciate your time and willingness to be in this space with us. Just really quickly before the breastfeeding landscape analysis report, just wanted to provide additional context for the importance of this meeting. Human milk feeding is a critical public health and reproductive justice issue, and we know the importance of this practice is beneficial to the health and well-being of both the infant or infants if there are multiples and the lactating person across their lifespan. However, we also know from many lactating individuals and families experience systemic and structural barriers that make it really challenging to provide human milk to their infants. And while California is And while California, through the amazing work of the California Breastfeeding Coalition, is often seen as a leader in this field nationally, I know a great deal of the work to protect, promote, and support breastfeeding happens at the local levels, right? Through collective and collaborative efforts led by coalitions. And unfortunately, as Soler mentioned, San Francisco has been without an active breastfeeding coalition since 2016, 2017. And so it's our hope through this report to reestablish the San Francisco Breastfeeding Promotion Coalition and to really build on the great work that was led by Gloria Thornton and the previous leadership team. There are so many wonderful and yet somewhat siloed human milk feeding and lactation efforts happening right now in San Francisco. And so we're really hoping to strengthen all of those efforts. And before I turn it back over to PTBI, I wanted to take a moment to acknowledge and lift up the work of Pretty Rain. Pretty has been highlighting the need and really championing the need for an active coalition in San Francisco since around 2017 and 2018. So it's really exciting to be here in this space and time. So thank you to Pretty, and a huge thank you to the Preterm Birth Initiative for leading this work. It's really important, and so really excited to hear this report with all of you. Janina and Selena.
Your patience with us as we sorted out our technical difficulties. I'm Janina Ong, and I manage this project, and I'm proud to present to you our report, Breastfeed is Like a Medicine, the State of Human Feeding in San Francisco. This is our team. That's okay, Selena, you can go to the next slide. This is the team that worked on this project alongside me. We had some graduate student researchers and some LEAP fellows, as well as Selena, who is managing our slide deck and lots of our tech today. Today, you'll hear from Lupita and Amanda, who were an active part of the project, but everybody listed here was an active part of a project. But today, they will be presenting alongside me. I tapped the screen as if I could change the slide. A little bit of background. I know a lot of us are immersed in this work and know the benefits of breastfeeding. So I think the background for us that's really important is that in San Francisco, 94% of mothers surveyed intended to breastfeed after birth, and then 70% of those women hope to exclusively breastfeed. But only 87% of the mothers in San Francisco were still breastfeeding, and 39 were exclusively breastfeeding at 6 months. So there is a little bit of a drop-off rate, even though the intent to breastfeed is there. So in this landscape analysis, we talk about some reasons why this could be happening and what supports we can offer. The next slide, please. So our report's key findings are these 4 bullet points that provider education around lactation feeding greatly varies depending on the provider's specialty area and their personal interest. Due to an inconsistency in education and training relating to lactating practices, many providers and workers who work with families have different perspectives and approaches to supporting families. Our 3rd bullet point is that, while providers' approaches to patient education and support varies widely, almost all had a strong desire to provide or recommend culturally congruent prenatal discussions, normalizing breastfeeding for that birthing person, their families, and their community. So there is like a desire to provide this, sorry, my son is really loud, to provide this for our families in San Francisco. One thing that was identified as a challenge was return to work. It's definitely a barrier faced by new moms and postpartum people. It seems like there is little actualization around legal protections and low provider knowledge about how to support these families when they do have to return to work. Next slide, please, Selena. For our project, we were tasked with creating a landscape analysis. We believe it's the cornerstone of every powerful place-based strategy. So for our landscape analysis, we focused on collecting qualitative data through interviews and focus groups. The questions we sought to answer were these 4 that are listed here. They are: what knowledge and education are stakeholders receiving about human milk feeding? What does the training around lactation look like for hospital and community-based stakeholders? What successes or challenges are the stakeholders experiencing in human milk feeding? And finally, how is return to work currently addressed and experienced? Next slide, please. Our team's research process involved the following activities. We did a literature review of different articles, journals, databases within the last 15 years on any aspect of human milk feeding, inclusive of breastfeeding, pumping, and lactation. We conducted the landscape analysis, identifying several other programs in the state, in the county, and nationally that have had successful programming or interventions related to human milk feeding. And then finally, what we're going to be really reporting on today is the surveys, interviews, and focus groups that we did with Department of Public Health staff, physicians, nurses, midwives, lactation consultants, doulas, and leaders of community-based organizations. So we'll be reporting that part out today. Next slide, please. For the informant interviews, we were able to reach 31 professionals and used semi-structured interview guides. We gathered data in regard to approaches to breastfeeding, policy and fiscal implications, training and education on the topic, perceived barriers, and more. During these interviews, the team also assessed people's willingness and capacity to participate in the coalition and potential barriers to that participation. Next slide. These findings were, we produced a thematic analysis on the qualitative data that we received, and we had these 4 findings. Theme 1 and theme 2 are going to be covered by Lupita, and they are a lack of formal education and training in breastfeeding. And then theme 2 is inconsistent messaging about infant feeding and family-centered decision-making. Theme 3 will be covered by Amanda, and it's a need for patient outreach and support beyond lactation promotion. Theme 4 I will cover, but our graduate student researcher, Brooke, did a lot of this work. There are systemic and considerable challenges to return to work and continued human feeding. And now I will pass to Lupita.
Thanks, Janina, for just setting that up nicely. So we decided to use this quote. We didn't get a lot of information in medical school. We didn't get a lot of information in residency. This resonates a lot with our first theme. Next slide, please. So the first theme, as Janina mentioned, is a lack of formal education and training in breastfeeding. Provider education around lactation feeding greatly varies depending on the provider's specialty area and on their personal experience. Lactation training is not mandatory if the provider is not specializing in lactation. Consulting is something that we found throughout our interviews, and we also learned that some providers felt that the extent of their knowledge was focused on breastfeeding promotion, specifically campaigning to encourage this choice among families rather than learning how to provide thorough explanations on how to support families to successfully feed their newborns and human milk. It was common for providers to be dependent on IBCLCs and WIC to provide patient education and lactation support. We saw through our interviews WIC come up a lot as a resource for both providers and parents. Next slide, please. Providers stated that they received training via 3 main methods, which we're going to discuss in the next few slides. Medical school was one of the places where individuals stated that they got some information. Some powerful quotes that we chose for this were, I would say that the amount of training in residency was probably about 10 hours total in residency, which is not enough. We didn't get a lot of information in med school. We didn't get a lot of information in residency. I'm a registered dietitian and I went to San Jose State University and got a degree in nutrition. When I was there, we had 5 minutes of breastfeeding. So we see that there's that it really depends on your specialty area, as was previously mentioned, and the timing and of all this depends on what school you went to and just what program you're pursuing. We also learned that a lot of people learned about breastfeeding from personal experience. One of the powerful quotes is, "When I was pregnant, I signed up for a breastfeeding class with Kaiser," which I think was helpful in understanding what to experience and what to look out for when breastfeeding, including what his poop would look like when he's breastfeeding and better ways to support him latching. I learned a little bit from that course, but I learned a lot from my colleagues. So here we see people seek out knowledge from other individuals, whether that be colleagues or just family members. Another quote is, "I did attend this adverse childhood experiences and breastfeeding webinar that talked about families that experience exposure to toxic stress and the impact of that, of what that has on breastfeeding." Again, health professionals bring a lot of lived experience into their work, and there are many different avenues from which this information comes from. Next slide, please. Seeking out additional trainings was the other source of education for a lot of providers. One provider mentioned, "I listened to a lot of lectures from people who do that kind of body work to help me understand when the problem is caused by a physical piece of tissue versus when is the problem caused by muscular tension. I also learned what to do about each problem and who to look for in the solution." And here we see that individuals want to learn more, and it takes a lot of intention to seek out something that answers our questions. Another individual said, "My initial education did not provide as much information I have since gathered on my own. Additional education on the oral structure of the infants." Again, health professionals are eager to learn more about how to support parents beyond just lactation promotion. Next slide, please. In regards to this issue, these are the recommendations we have. More direct hours focus on lactation and human milk feeding during training. Currently, medical schools do not require all specialties to complete trainings with IBCLCs, but it could help bridge the education gap among providers. One OB-GYN said, "I wish medical school had 10 more hours required training with lactation consultant." This could be something that could be addressed at an institutional level, or it could also be addressed in another way. But we do see, again, the theme of people wanting to learn more about how to support parents. Next slide, please. Another recommendation is having more culturally congruent providers of lactation support. Multiple stakeholders mentioned that there's a great demand for more diversity among providers and in clinical settings. Someone mentioned, "I think we need more trained lactation support and providers who speak languages other than English, who are representatives of communities where there are breastfeeding disparities." We learned that there are a lot of videos available in many different languages through WIC and in different counties. But I think it's different to have someone that speaks the same language, because there could be questions that arise after video trainings. And this is something that would just promoting diversity among IBCLCs and other lactation support could greatly benefit a lot of individuals and address this. Next slide, please. Another and the final recommendation for this is having improved collaboration among providers. Some individuals express that having more collaborative efforts among many clinicians is an opportunity to better serve their patients. This could look like having a more streamlined approach beyond just WIC, just having a system in place that helps get the resources to individuals among different providers. An individual mentioned, "I think the problem with the clinic aspect of working is that you're so busy, you don't have time to hear from your colleagues out in public health nurses, which I used to be in touch with all the time. I think there just needs to be better collaboration." So again, that is something we want to see come from this coalition, is just more collaboration and just having a more streamlined approach. Next slide, please. Fed is best. We would rather you give your infant some formula so that the kid is eating and you can still work on your breastfeeding relationship. This nicely leads into theme 2. Next slide, please. So theme 2 is inconsistent messaging about infant feeding and family-centered decision-making. Currently, there are no standard guidelines for providers to refer to. Breastfeeding promotion materials leave many parents under the impression that breastfeeding is easy and that it often described as intuitive or natural. For many, breastfeeding can be difficult, challenging, and frustrating, with the message that breastfeeding is natural, contrary to their lived experience. Due to inconsistency in education and training relating to lactation practices, many providers and workers who work with families have many different perspectives and approaches to supporting families. Next slide, please. Here's a sample of what the team heard from stakeholders when asked about their thoughts and knowledge around breastfeeding. If you can get it going, it's easier than using formula, but it's challenging. Another person said, I was taught that breastfeeding took too much work for working families. Another individual said, actually, formula adds risk of SIDS, all sorts of things that people don't understand and know. Another said, I think a law was targeted around, here are the benefits of breastfeeding if you decide not to breastfeed. Here are the potential consequences. Another said, my initial education did not provide as much information I have since gathered on my own, additional education on the oral structure of the infants. So again, here we kind of go over a lot of the different, just a lot of the different knowledge that people have in regards to the harms of formula and then the benefits of breastfeeding, which is again relating to lactation feeding as campaign, and we sometimes or there's an opportunity to improve how to support lactating parents. Next slide, please. Moving from promotion to practice. Today, lactation education is closely associated with lactation promotion. There's very little information shared on how to support and coach parents who experience lactation challenges. The best way to support concerned parents is to listen to their concerns and help them make informed decisions for their families. I think a big takeaway from this is the word listen is often it can be more simple and straightforward to give resources, but sometimes we're not really hearing the question. So I think that's something important to just keep in mind going forward on how to support parents. Next slide, please. We make it more personal when discussing how they plan to feed their baby. If they say they want to exclusively breastfeed, then we talk about that and what that looks like to them. What supports we can offer, and if we need to go outside of our organizations. We point them to where they can get what they need depending on whatever they say. Next slide, please. The question of formula. This was something that is just as important to discuss just as lactation feeding is, just because it's an alternative that many people use, and something that came up a lot is that providers have a lot of information in regard to lactation feeding, but their training didn't offer as much information on how to answer questions relating to formula. There are many different reasons why parents may choose to breastfeed their infant formula, including experiencing breastfeeding challenges, having to return to work, or physiological reasons. Unfortunately, there is messaging that can cause stigma among parents who choose to use formula. There's a tendency to see it as harmless. One individual shared, well, they're giving a little formula, no big deal, but we do know it's harmful. Once you start giving that formula and you see that the babies react, and you see that baby's reaction, most babies are going to suck it down. So this individual was speaking about just mixed messaging in regards to formula feeding, and maybe parents aren't getting all the information they need to make the best decision for their infant. Next slide, please. Another provider noted, my education was very focused on breastfeeding and human milk feeding. I think one area of my education that was lacking was actually formula feeding, and also how to bottle feed appropriately. Again, we see that there sometimes formula doesn't come up in regards to education for providers, and it's an area that could be greatly improved through just having additional trainings, or whether we have trainings earlier on throughout med school or other or in other settings. Next slide, please. So we have 3 recommendations for this theme, that being build in continuity of care. So one quote is, lactation support is also expensive. If you're an IBCLC and you need to visit someone at home and their insurance is not covered, a lot of insurance doesn't cover it. That's a barrier cost. So this was a big barrier that we saw, is just people not having care beyond the hospital, or just being left feeling alone, just in terms of having someone to ask questions to, and sometimes insurance or just the cost comes in the way of that. Another quote is, we have one lactation consultant at the hospital. There isn't that much expertise. Once they go to the outpatient setting, and if there is a problem, then the providers struggle to support the family adequately. There is a lack there. Again, having care, having home visits. We know there are some programs in the area that do offer visits, but that's very variable. So this goes in hand with just having a more streamlined approach of having resources available for people. Next slide, please. A second recommendation we have is emphasize parent education and family decision making. This looks like to be able to further promote patient-centered care, families must be given all the tools to make an informed decision on feeding practices. In order for parents to be able to make the best decision for their family, parents must be given the appropriate amount of information prior to the arrival of the baby. We did see that some people received information once the baby had arrived in regards to lactation feeding. So that may be just having resources available earlier on. Next slide, please. The third recommendation we have is normalizing human milk feeding in communities. Someone mentioned, I want people to understand that whether they're in a school or whether they're in a workplace or a place of worship, wherever they are, unless you're in a private home of a person, that's the only time someone can tell you not to breastfeed. Other than that, you can breastfeed anywhere. Someone else mentioned normalizing it as a normal thing, normalizing breastfeeding as this is just how people eat. This is how this person's eating. So there's an opportunity to just within our community to just have breastfeeding be normalized. And this came up through different interviews. It's just having the parent not feel like the target of the room when they're simply feeding their baby. So that could be just a more social shift. Next slide, please. Okay. And then I'm going to kick it off to Amanda.
Yeah, if you could go back, Selena. Sorry. So kind of moving into our third theme, we have a quote here that highlighted a big idea was making breastfeeding culturally relevant means unpacking the trauma of white supremacy and systemic oppression that has been cloaked over our experience. Next slide, please. So this kind of jumps into our third theme, which is a need for patient outreach and support beyond lactation promotion. Okay. And so our community-based providers and organization leaders had many ideas for increasing accessibility to breastfeeding resources and achieving the overall goal of increasing long-term breastfeeding rates. So during our interviews, stakeholders highlighted many gaps in current family outreach efforts and approaches to infant feeding discussions with expectant families. So some of the recommendations that arose included, number 1, increase culturally congruent care, 2, having prenatal discussions, and 3, an open-minded approach to second-time parents. Next slide, please. So of all our interviews, every single interview touched on one or more of these themes of patient outreach, whether discussing what is currently being done and improvements to be made. Next slide. So starting off with our first one, which is to provide culturally congruent care. This is the concept that medical staff implement knowledge of how culture can influence one's health beliefs, practices, and communication patterns at each stage of care. So overall, culturally congruent education works to break down these barriers to care and make lactation support more accessible to underserved populations. So although there are strides to achieve greater cultural competency, there are still aspects that still need to be addressed, which includes culturally relevant programs and resources. And so at the time of this report, 9 out of our 17 stakeholders that we had interviewed called for improvements in cultural understanding and relevancy. Okay. And so then a key quote that we found and a big topic that was highlighted was the generational trauma presented. And as described by this quote, there needs to be a better understanding of the historical trauma that the Black and African American community has experienced around breastfeeding and nursing, that during slavery times, their infants were often taken from them when they were born, and then they were given white babies to wet nurse. This is a historical generational trauma that is just a part of the whole historical impact of slavery and racism on that community. So we really saw that there was a lot of gaps in this understanding, and a lot of our stakeholders recommended that there needs to be more culturally aware and better education around that, so they can better help their communities. Next slide, please. Okay. And here we have some samples of what was shared along the lines of providing culturally congruent care. So one of them was, how can you expect good health outcomes or expect parents to meet their breastfeeding goals? Everybody has to do the same thing, supposedly, and we're not asking what is each parent's goal. How can they meet their goals when they can't get education that is culturally relevant or in their own language? We're seeing a lot of the same kind of ideas that Lupita mentioned previously about having these culturally relevant and language and breaking down these language barriers. And then also there is just a lack of connection in being able to offer resources that are culturally appropriate. I feel that it's definitely a barrier to folks of color. Most people don't have a provider that's there who looks like them or can relate to them culturally. Next slide, please. Okay. And so then we saw that there was definitely a push for diversifying the field. So I feel strongly about diversifying the field. I feel very strongly about diversifying. Oh, I think it's a repeat. Sorry. As a part of a new parent a long time ago, my kids are much older. I never saw a lactation consultant that looked like me. So while there was a lot of talk about having diversity in the field, there was also people that were our stakeholders that were noting that although they're very big on racial concordance, but it's not so much racial concordance, it's culturally understanding. I think that's important. Then also I think that there needs to be some type of linkages between this coalition and the practitioners on the ground as well. So there was kind of this link between going further than just diversifying the field and making sure that people are actually understanding the different cultures that they're working with. And our second recommendation that we had within this was having prenatal discussions about infant feeding. So many participants either noted a lack of patient outreach in the prenatal period or admitted to only talking about infant feeding options postpartum. So some issues presented were that families who were presented with their options for infant feeding postpartum did not have the time to consider other options and a long-term feeding plan. So without having this time to make an informed decision and develop a plan, families may struggle and change their course once they're home with their newborn. Specifically, outreach in the prenatal period was recommended to give proper time to contemplate their options and enter their feeding journey with a more open mindset. So additionally, it is important for families to consider questions about their future work plans and their return to work in order to coordinate around continuing to provide their infants with human milk. And unfortunately, when patient education does occur, it's often when the family is already struggling with their breastfeeding journey. And many times families don't bother to reach out and just opt to switch to formula. So one thing that we did note was kind of having this increased conversation with OB-GYNs to kind of have them discuss this in their prenatal period, because we noticed from our interviews that there was a lack of support in that aspect. And there was not any resources provided for different families. So having a collective resource sheet that could provide contacts for help would be really important. Next slide, please. Okay. And then lastly, within this was approaching parents who have already had a child or children with an open mind. So a misconception is that we saw families will feed their new infants the same way as their first. We noted that parenting is a learning journey, and so it's really important to approach every expecting family by discussing a feeding plan with an open mindset and a learning journey, whether or not the family has had a child before. So each child is unique and comes with their different needs and is not a one-size-fits-all journey. So it kind of comes on both ends of the provider as well as the parent to come to these appointments with an open mindset and be able to have these discussions. And then I'll hand it back to Janina for the last theme.
Thank you, Amanda. I'm hoping my Wi-Fi stays stable through this, but here we go. So my theme is about return to work, and this is a quote that's indicative of the theme itself. This provider stated, people have to return to work. They have other time management issues like balancing other family dynamics that make it difficult to prioritize breastfeeding. Something that came up was that, there can be unrealistic expectations, which can be challenging for parents. Oh, I feel like this slide is out of order. Sorry, yeah, it jumped a few slides. 1 second. Okay, there it is. There are systemic and considerable challenges to return to work and continued human milk feeding. Barriers to continued human milk feeding arise when a postpartum parent returns to work. These barriers can be difficult to address through policy and guidance. In our interviews, participants who are stakeholders supporting families describe that the frustration that postpartum parents experience comes from a variety of reasons. Sometimes it's a lack of maternity leave that allows them to breastfeed for at least 6 months. Other times it's that they feel that their job is insecure when they ask for the protections that are provided by the law. The fact that there are not paid leaves when it comes to the breaks you take. So these are a few quotes that we got from stakeholders. One said that there's definitely a lack of parental leave, or even if you have some parental leave, it's not enough, it's not long enough, or you only get partial pay during your leave. Most families can't afford that. Most families can't afford to not have a paycheck for several weeks or months, however long. Another stakeholder who we talked to said, we have work protections, but it's not really well enforced and people don't feel empowered. Another interviewee simply stated they would probably just lose their job. I think that there were a few recommendations, but it's definitely an area that we should explore deeper if there is interest in this. The recommendations that came from the interviews in regards to this theme around return to work and the systemic and considerable challenges experienced were really these two, that we should advocate for postpartum parents in regard to workplace rights, paid leave policies, and basic supplemental income. The second one being that we should try to educate employers and managers on parents' rights to pump at work and have them actually advocate for parents to pump. So like they can be the ones to be like, hey, so what is your plan? Like, do you need a space? How can we set this up for you? I think that that would be amazing. And then that ends the 4 themes for us. We were able, aside from the informant interviews that we did with stakeholders, we were able to do a couple of focus groups with some new parents to see what they said about human milk feeding and to see if it kind of aligned with what we found from stakeholders. Lupita and I will be passing off for this section. So one finding that we heard during the focus groups was that parents do have a good understanding of the benefits of human milk, but still sometimes use formula out of necessity. So like providers said, they think that, most parents know why it's important to breastfeed, and you see this as well in the quotes that have been shared by the new moms. One mom said, breastfeeding is like a medicine. It is like life. It is everything. It's their life, their oxygen, their food, their reason for surviving. Another mom took a more scientific approach and said, well, mom passes antibodies to baby. Babies are less sick when they are breastfed, and they just get a lot of great nutrients from the breast milk and so much more other great stuff. In regards to when people tend to use formula, one mom answered, maybe sometimes a mother is tired like me, is very tired of the housework and the work, so the human milk is reduced, so then I have to mix with the formula together. I will pass to Lupita.
Parents utilized recommended resources that are provided. The parent said, I learned about breastfeeding through WIC and they were so awesome. I think there was a lot of praise among parents for WIC, so that's important to note. I was in a class with WIC with my second, even though I had another one. I was just like, why not let me take it? I feel like every time I take those, whether it's classes or ask the nurses when I had my baby, I keep learning new things, or maybe I'm forgetting. I don't know. I like that there's so many different venues for learning, because sometimes you forget it, sometimes you learn something new. So again, parents really enjoy learning about how to breastfeed and just bond with their baby.
There was also this theme of like unrealistic expectations, which were challenging for parents. A few parents said these things below. One mom said, I wish that they said that breastfeeding isn't natural. One can run out of milk, or rather, if you were stressed or depressed, you could have a low supply of milk. Another mom said, they make it look so easy, but it was not. I had to learn it. Once you got the hang of it, it got easier. And then another person in a focus group said, then I feel a little weird about how to lactation really fluently and naturally. In the first breastfeeding, it's hurtful, but I still keep trying. So I think that, the way that breastfeeding has been promoted a lot as like natural, but it's not easy. You do need supports and resources. And these moms are sharing that even through this, they persisted, but there were certain things that made it harder on them. Lupita?
Parents who are supported can proudly achieve their infant feeding goals. A parent said, then you see them getting chubby, so you're like, oh, okay, they're getting enough. Those are some of my experiences. So again, a positive experience of a parent who was able to reach their feeding goals. Another parent said, you can't just explain, you cannot explain the love. You can see that there is a connection. You forget the pain at the time. That's how it is. This parent was speaking on their bonding experience. Although it was challenging, they felt like it was highly rewarding. Another parent said, it's an amazing experience, not only because you can only just roll over and just whip it out and put it in their mouth and they can still stay asleep, but also because it gives you a great bond. So again, although there's a lot of challenges and although there are a lot of challenges in regards to breastfeeding, there are a lot of success stories, and parents have a lot of good feelings in regards to reaching their infant feeding goals. Next slide, please. Sorry.
Okay, I got it. Over the course of this report out, we have shared several recommendations built into the themes that we shared, but I did want to put them on 2 slides together so that we can think about it. I think that these recommendations are things that the coalition moving forward can think about and put their energy towards, if that's what is agreed upon, of course. But I think that these themes and even the recommendations came from the stakeholders that we talked to. So you'll see that, there is a need for further education or additional education. There's a need to create pipelines for more diverse folks to be in this field. There is a yearning for culturally congruent providers. In terms of inconsistent messaging, there's a desire for a built-in continuity of care, emphasizing family decision-making processes and normalizing human milk feeding. And then in terms of patient outreach, I think that as we've heard from the focus groups, parents do understand the benefits of breastfeeding. So moving beyond lactation promotion and more towards like, how can you support when challenges come up? Again, doing that through culturally congruent care. Maybe even having discussions prenatally. You know, a lot of folks on the call do this with their clients. They have prenatal discussions about infant feeding as a whole and what the choices parents have, and then, you know, what their lifestyles are looking like. Do they intend to return to work after 6 months or after 6 weeks, right? There's a huge difference between those. So, and then there's this also notion that, you know, approaching parents with children with an open mind and still having that same discussion with them, even if they've already had a discussion like that with their first. In terms of the, you know, return to work challenges, advocating for postpartum parents and educating employees and managers on parents' rights. There are some further questions that our team ran into at the end of our analyses. So I think one thing that kind of led off of the return to work question, because the women in our focus groups actually didn't return to work. And I think it would be good for us to talk to more postpartum parents as a whole, is if there is an uptake of the lactation protection policies at work, because we know that the state of California has amazing you know, rights for people to pump at work. But I guess the question is if they are actually being used, if managers actually understand what the protections are and how to make sure that, you know, parents are using them, but beyond whether they're being used or not, if they actually satisfy the need of parents wanting to continue human milk feeding, right? Because I think in California, you get 2 paid 10-minute breaks and then an unpaid lunch break. So I think it's, you know, if people need to pump more than that over an 8-hour shift, it is not really serving parents to just cover that, right? It's just the bare minimum. Our second question really came from the issue in regards to the demographics of who we interviewed. You know, we were wondering if male providers understand and approach, you know, discussing infant feeding with families, how they do it, just because the stakeholders, the project team interviewed all identified as women, and lots of them regarded their personal experience as part of their training. So I think it would be interesting to do a further scan of like pediatricians and OBGYNs who are male to see how they approach this topic and whether it's a priority for them. That concludes the report out from our report. You can find all our findings in our PDF. So this is really a summary level, but we have a PDF version of the report that'll be sent out right after this meeting. We have a few more things on the agenda today. I know we're running kind of a little bit behind, but first, Preeti Rain from the Department of Public Health will say a few words about, you know, why it's important that this breastfeeding coalition comes together in this time. And then I believe either Brandy or Fenwa will give us some next steps to think about in terms of what it means to join our coalition and be a part of our work. And then we're hoping to do very short at this point breakout rooms to just garner your initial feedback from the report and the recommendations. So I will pass to Preeti.
Thanks, Janina. This is amazing. Thank you to the entire PTBI team for all of this effort and really engaging stakeholders and partners in the community to make sure that we have a great foundation to stand upon, right? We're not assuming what the issues are, but really we're taking the input from the community as we build the priorities of the coalition work. So really had, you know, really an amazing job, and I can't thank you all enough for doing such thoughtful work. On behalf of the Department of Public Health, we stay committed to this work, and I'm really excited to see where this coalition will take us to, and all of the great work that, you know, that possibly can come from all of these partners and stakeholders working together and really providing the wraparound care and support around lactation that our community needs and deserves. Whether it is around provider trainings or providing support to workplace or lactation accommodation in the workplace, or just how we can better support the family. So really excited, and we're in full support of this work. And I really, again, a huge applause to the BTBI team, Ifembod, Janina, Solaire, but really the entire team on this amazing kickoff work, and we're really excited to continue working together. And back to you, Janina.
And then next, I believe Ifenwa will be filling in for Brandy to talk about the coalition meeting that we'll be hosting in September, and just a few thoughts around, who should sign up for that.
Yes, hello everyone. I echo Priti and wanting to thank the PTBI team for doing such a wonderful job with the landscape analysis. Brandy Gates Burgess sends her regards. Unfortunately, she's not able to be here today, so I'm happy to fill in. In thinking about next steps for the coalition, there will be a following meeting, a second meeting convened in September. You will receive information of that following this meeting. In the chat, I believe Selena put a link in for those who may be interested in engaging further and really helping to support reestablish the San Francisco Breastfeeding Coalition. This work cannot be done alone. And so we're really looking for folks across the city and county, across institutions, across hospitals, across different settings, acute care, primary care, public health, to really come together to build that collective impact and coalition that you've heard so much about throughout this presentation. As was previously mentioned, San Francisco is one of the only counties in the Bay Area and in California that doesn't have an active breastfeeding coalition. And so we really are hoping to engage as many of you as possible, and even some of your colleagues who are not here with us today. If there's any interest in capacity, we really encourage you to come join us in September. And at that meeting, we hope to have a more robust discussion, really building off of the themes that were presented today, and to really identify the goals and objectives for the coalition going forward. We'll have more discussion in regard to logistics and things of that nature, but we're really hoping to build on this momentum and to continue these really important discussions as they really impact, to really ensure that the individuals and families giving birth in San Francisco have the support and resources they need, regardless of what type of infant feeding method they're utilizing. We really just want to make sure that all families have the resources and education and support that they need to make the most informed infant feeding decisions that are best for them and their families, in addition to supporting providers and the systems that are responsible and charged with providing that education and support. So more on the follow-up meeting to come. With that, I will pass it back to Janina and the PTBI team.
Thank you. So in that form, you'll see that we are also asking people for your availability for 2 dates in September. So please fill that out so that we can also settle on that date for that second meeting that we'll be holding in person. Now we would like to spend some time in breakout rooms talking about some initial thoughts in regards to the report. I have 3 breakout rooms that I'm about to open, and you can.
We want more time. I know. We've got about 10 minutes with you all, and so we just want to make sure we can hear some of the highlights that came out of your discussion. So if we could get one person from each group to just share a couple of highlights from what you discussed, and if we could start with group 1, our physicians, midwives, nurses, hospital health workers, if one person could share a highlight or two from your group.
Katie, do you want to share?
Yeah, sure. I can share. Yeah, I mean, when there was amazing information, and like Larry mentioned, never enough time. But some of the key things that came out was around just the competencies for providers and the support that they can provide to families, and not feeling that they are trained enough, but also the fact that there's limited time and capacity for a provider to be covering everything during the meeting. And so really having those resources that they can then work with and partner with to make sure that the family is getting the support that they need, hand in hand, making sure that the lactation support is then reimbursed. So all of this is all connected, and and works together in order for really providing those that wraparound support for lactation to the families. Also, some of the small things that came up, that potentially could be the coalition could take on is like the resources that are available, the sharing, the collaboration, and the partnerships that can happen. So if somebody has created something that can be shared out in the broader group, so that we can rebrand and then share it out to, so that not everybody is recreating everything, and then at the same time we are being consistent with the messaging. So those were some of those other things that came up too, but keeping it short. And those were some of the key things that came out of our discussion.
Thank you, group one. Can we get a person to share from group two, the CBOs and doulas group?
I am happy to share, but if there's anyone, Troy, I'm sorry, you got cut off mid-sentence. If there's anyone from my group who would like to share, then I would be open to opening that to you. Any takers? No? Okay. All right. Well, so we talked about a few things came up around access to care within the community, having the need for like lactation cafes and groups where people can go and and get support, but also access to in-home support, how to fund that so that it is beneficial for both the families having that access, and also that the lactation consultants or specialists are able to get paid and reimbursed, for their services. We talked about WIC came up, and the issues in access to lactation services within WIC, and how that's tied into lactation access issues for people who have Medi-Cal, because often the assumption is that Medi-Cal covers lactation services, but it's only within like the clinical settings, and then people are often told, well, you can go to WIC and get lactation services, and that's not always the case. What else? Talk about funding, maybe having private businesses sponsor some of this lactation support, issues around grants. Transportation is an issue. Again, I brought up classism and how people who have less access to money, wealth, and resources are often having to go out of the home for things that other people are getting within the home. And so there's issues around transportation, and also just barriers beyond just language and culture and things. But it is hard to get out if you have a newborn and other children. Maybe someone has other disabilities and things. So, true equity and diversity in terms of the lives that people lead, and whatever physical or, disabilities or abilities that they may or may not have. Yeah, and then capacity building for doulas and, strengthening that work. So that's about it.
Thank you, group 2. Thank you. And group 3, public health practitioners, legislators, mamas, and community members. If we could get somebody from group 2 share, please.
Selena, you have our notes.
Yeah, I had the note taker role.
I'm totally kidding. No, there was a few things that folks discussed. I do recall hearing from a lactation standpoint of view of having meetings with hospital staff or just folks in the hospital saying we have all of these resources and great resources, and yet people don't know about them. How can we close that gap? How can we get these resources to people? Excuse my toddler, you guys. He's home with me today because his school decided to have a prep day and I'm trying to allow it and be okay, but he's here. So you're going to hear him. So we also talked about our working moms and how not everyone has your typical office job where you're like at the office, go prompt really quickly or whatever you need to do. So we have some mamas who are in construction, and what does that look like for them? Are they being equitable? Are they being fair? Are they creating space? We also talked about capacity at these hospitals and how you could be giving birth at a time where there's a bunch of other mamas giving birth and there's 2 lactation consultants on the floor and you don't get one for a couple of hours, or you have to continuously advocate like, hey, still need that lactation consultant to come in here. So how a lot of this work starts in the hospital. So I'm like nutshelling all of what we talked about, but those are the things I remember. If anybody else wants to chime in, please feel free.
That was great. Thank you, Lauren. So I see Janita just shared in the chat that there is going to be, there it is, a post-meeting feedback poll. So please, you all make sure you are filling out that poll before you head out. But I just want to say, thank you. Huge thank you to everyone that spent time with us today. I definitely learned a lot today, and I'm really excited about what's to come. This work is so important. It's so critical, and just hearing from moms, hearing from providers, hearing from each other about what this looks like for us and the roles that we can play. There's a lot of opportunity here to do something different, especially in a place like San Francisco. A lot of the things that I was hearing, I was like, oh, that's an app. Oh, that's a program. Oh, that's a project. We can work together to get some funding, work together to come up with innovative solutions to do this. But the key word is together. That's why we need coalition and we need collaboration. I think when we put our minds together, we can really do some amazing things. So again, huge shout out to everybody that's here. Thank you so much for joining. Please don't forget to fill out that survey so that you can continue to follow through and follow us as we are continuing this breastfeeding coalition, and then complete the post-meeting feedback poll. And with that, we can close. Thank you so much, everybody. Thanks for joining. Hope you have a great rest of your day. Thank you. Take care. We'll be in touch.
Thank you so much.
Thank you so much. Bye. I gotta hop to another meeting. So
No worries. Thank you. Thank you, Fenwa. Thank you, Solaire.
Bye.
Bye.
Bye. Sorry, I was just staying on because I was like downloading the poll result.
Yeah, I know, but it looks pretty good. So we got 18 people to answer, and yeah, people said we're okay. I think that went okay. Oh my gosh, the tech issues at the start of that was like
Oh wait, oh no.